Good morning, everyone. This is Eric Williams. I'm the director of the Office of Provider Network Supports. I'm joined today by Barry Seaver and Sophia May Smith, and we're going to get started in just a moment in the interest of time, because there's a lot of information to cover and we want to get through everything. So I'll go ahead and let Barry start when he's ready, and we'll continue to let folks in the meantime.
Good morning, everyone. Glad you're here. We're going to go ahead and get started. So we're going to cover the provider data summary today, which is the state and Virginia's developmental disability services. This one is for May of 2023. So next slide, please.
Okay, and if Sophia could take over letting folks in, I'll go ahead and work the slide. Thank you, Sophia.
We're going to ask that everybody use the chat to ask questions and make any suggestions about how this information can be more useful to you. We are recording this, so we will record the chat. If we can't get back to questions or suggestions right away during the presentation, we will do so afterwards with a follow-up Q&A. So what we're going to cover today, it's a lot of information. Of course, the introduction, which we're doing now. We'll talk about the activities of the Office of Provider Network Supports, which used to be the Office of Provider Development. It's a new name for our office with Provider Network Supports, still the CRCs, and Eric is our director. We're going to go over some performance measures and demographics, plans for the report automation, statewide and regional service data, identified service gaps, and then we'll have a little bit of time at the end, hopefully, for some questions. I was referring to the Office of Provider Network Supports. Our mission in the Office of Provider Network Supports focusing on developing and sustaining a qualified community of providers in Virginia so that people who have developmental disabilities and their families have choice and access to options that meet their needs. Our primary outcomes include individuals, people with developmental disabilities live personally meaningful lives in their community of choice. For providers of developmental disability waiver services have access to information and technical assistance that supports best practices. And for system, DBHDS provides resources for support coordinators and providers that are based on promising and best practices in supporting people with developmental disabilities in Virginia. I was referring to this a little bit earlier. In 2023, the Office of Provider Network Supports was reorganized into two distinct capacity building teams at the following levels: provider and system. And then you have three statewide positions were defined, focused on individual and family waiver supports, regional support teams, and complex supports to more effectively accomplish our mission. We do have a new contact sheet on the website, and it's designed so it's simpler to identify who would be a person to contact based on their expertise and their mission. So, and the link is there to get to our contact information on the website. So the services considered in this particular analysis are benefits planning, community coaching, community engagement, community guide, electronic home-based services, employment, community transportation, independent living supports, in-home supports, peer mentoring, shared living, supported living, crisis support services, private duty nursing, skilled nursing, and sponsored residential. And as of 10/31/22, group homes less than 5 and group homes residential 5 or more. As I said, a lot of information to cover today. This is the primary time frame that we covered for this data. So running from June of 2018, the baseline, to April of 2023. And the chart below is an example of the existing sub-region breakdowns that we used. So the data included in this report is determined through the use of baseline measurement tool, which is a screenshot of that below. We will be discussing an online automated report option, which will be available to providers in the next report period. And the baseline measurement tool is on our website, DBHDS website, under Getting Help, Provider Network Supports. And I covered that already. Sorry, it was just in my head. And now I will turn it over to Sophia. Sophia, if you're talking, you're on mute. There.
Good morning, everyone. This is Sophia May Smith. What I would like to talk to you about today are the activities of the Office of Provider Network Supports. We'd like to start by talking about the My Life, My Community provider database and provider designation process. We established this database and process in November of 2019, and it is free to all providers. As of April 2023, we had 260 providers who are registered at this site. We are using this site as our search engine, so I encourage you to sign up if you have not yet done so. Once you're on the site, you have the opportunity to participate in our surveys and earn badges in specialization of autism, accessibility, behavioral support, and complex health supports. Currently, we have 4 providers holding badges in these areas, and the current focus of DBHDS Quality Improvement Initiative is to increase the number of providers on the statewide database who holds a specialty designation to at least 5 unique providers in each specialty area. To take a closer look at the provider designation process, you can see here that we currently have 2 providers holding an autism designation, 4 providers holding a behavioral designation, and 2 holding a complex health designation, and 1 holding designation in accessibility. If you look at the chart, you can see the names of those agencies, and they are represented throughout the state. Next slide. In order to find where you can register for the provider designation process, as well as our database, please visit mylifemycommunityvirginia.org. There you can find a tab that's called Find a Provider. And in the text boxes below, you'll see for providers, a provider hub. Once you're at the provider hub, look for where you could either register your agents or update information about your agents, as well as access the surveys for those specialty areas that we talked about previously. Other activities in the Office of Provider Network Supports include technical assistance. And between the period of November 1st, 2022 through April 30th, 2023, we offered technical assistance for DD waiver to 212 participants and 56 unique providers throughout this reporting period. Also, we met with 77 unique providers seeking to diversify or expand services. In Region 1, we had 44 providers. Region 2, we had 7 providers. In Region 3, we had 6 providers. Region 4, we had 11 providers. And in Region 5, we had 9 providers. Some of the services that we are included in this data that we're reporting are group homes, for which we had 6, therapeutic consultation 4, employment and community transportation, there were 3, in-home supports, there were 5, community guide 2, supported living, there were 4, in supported employment 1, Group day, we had 1. Community engagement, we had 1. Sponsored residential, 41. And in service facilitation, 3. For electronic-based home supports, 2. And companion, we had 1. Personal assistance, we had 3. And respite, we had 1. And some of the barriers that we noted included for the providers either not understanding the requirements, having difficulty hiring DSPs, difficulty hiring the qualified developmental disability professionals, the rate of reimbursement, also needing business license or needing DBHDS license. We also saw that the need for independent assessment for electronic home-based service was a barrier, understanding how to bill for assessments under the current system, having to submit authorization every 3 months for remote monitoring. Also, unable to add services due to multiple licensing citation and regulations not permitting providers to expand services while on a conditional license. These are some of the barriers that we identified during this activity period that we've just reported on. Next slide. We also offered peer mentoring training, and we were assisted with that by the ARC of Virginia. And on December 13th and 14th in 2022, a professional development workshop was offered on December 6th, 2022, and was attended by 7 mentors out of 11. The Jumpstart Funding Program also awarded $31,796.71 during this reporting period. We had Part 5 training, which is on the Commonwealth of Virginia Learning Center, and was accessed by a total of 1,421 individuals, with 1,183 people receiving certificates for completion. We had additional training to include ISP training for a total of 64 participants. In the Part 5 training, we had 65 participants. For documentation training, we had 47 participants. For the DSP orientation and competency training, there were 45 participants. For the person-centered thinking training, we had 81 participants. And the person-centered coaches training, we had 8 participants. Next slide, please.
Hang on, Sophia, it's having a little trouble switching. There we go.
Okay. Also, we offered the provider roundtable, and in November of 2022, the forum had 300 participants. In January 2023, we had 337 participants. And in April of 2023, we saw 390 participants join us. Another area of importance to us is the supervisory completion count from November 2022 to April 30th, 2023. We saw those who completed the supervisory training. As you can see from our graph here, we had in November 2022, we had 60 supervisors to go through. In December 2022, there were 43. In January of 2023, we had 58. Now we're heading in the right direction. In February 2023, there were 60 supervisors to complete. And in March of 2023, we had a high point with 89 supervisors completed. And in April of 2023, we saw just a small dip in the numbers, and we came to 85 supervisors who completed the DSP supervisory training. And in order to find where you can locate these important required trainings, We ask you to visit our website at dbhds.virginiaspelledout.gov. When you go to developmental services, you'll find provider network in the right column. And in that, towards the bottom, you'll see centralized training for providers. And there you'll see a drop-down box that has required and recommended training, as well as resources and information about peer mentoring. And this is what that page looks like. Once you've opened it up fully, you can then see the different sub areas that are below each of the pages. So you can see for required training that you have all the information regarding the DSP and the supervisory orientation competencies, as well as the training. You can find the test here, as well as the supplemental trainings that were added to our requirements. And if you have any questions about these, please reach out to your CRC, and that information is also located on our webpage. Thank you.
All right, thank you, Sophia. Good morning, everyone. This is Eric again. All right, so I want to start with thank you. We greatly appreciate, I think, your interest in this information. So whether you're here because, you just want to understand the status of DD service availability in Virginia, or if you're here because you want to help your organization diversify or expand service options, and you kind of want to know where might be the best places to do that, or if you just like data. But regardless of the reason, we're glad you're here, and thank you for your interest in supporting services in Virginia. So the rest of the presentation is really going to be a walkthrough data, a variety of data. And I'm going to share our perspective in terms of what we see in the data in terms of strengths and weaknesses in the system. You might, once you receive the report and the baseline measurement tool and take time to look at the information, find things that we haven't identified today. And we hope and expect that will happen. Jumpstart funding continues to be available. And so for all of the most integrated services that we talk about today, you can reach out to Sophia, who leads that project, if you are interested in accessing funding to provide some of the services we talk about. All right, so without further ado, we'll go ahead and jump on. Please be patient with me. The slides are not fully cooperative, but we'll get there. All right, so this is our measure section of the report, and measure 1 relates to ensuring that data continues to indicate an annual 2% increase in the overall DD waiver population receiving services in the most integrated settings. So as of this current report, this is the first time that we have met this measure. We have always fallen between 1 and 2% historically. But as of the most recent report, which looks at March 31st of 22 to March 31st of 23, we actually saw a 2.3% increase, which is great to see. The overall level of integration is at 90% of people in the system. When you do look at the written report, you're going to find several pages that list out the 133 localities in Virginia, and they are sorted by most integrated to least integrated. So wherever you're located, you can kind of take a look at that table that's in the report and get an understanding about the level of integration in your community. So just based on a review of that, we were able to identify that 24 localities in Virginia are 100% integrated. 43 of the 133 have an integration level of 90 to 100%. 32 localities were below 86%, and only 2 localities had an integration level below 50%. So by and large, Virginia has over time become much more integrated in terms of service delivery. All right, so measure 2 really looks at people who are new to the waivers, and there's a expectation that 90% of individuals new to the waivers, including individuals with a support needs level of 6 or 7 since FY16, are receiving services in the most integrated setting. So you see 2 tables in a chart here. So the table that you really want to pay attention to is table 1, which is there on the left. because that's the determiner of success. So that looks at the whole population. So 95.9% of people new to waivers since 2016 live in integrated settings. So most of the people coming into the waiver are choosing more integrated settings. Table 2 is only people with support need level 6 and 7, according to the CIS, and that's at 95.6%. And the reason we include that data is it's supplemental, and it helps us know that we are paying attention to people with more complex support needs and factoring them into our assessment of this particular measure. All right, measure 3, the data summary indicates an increase in services available by locality over time. So we have two charts here. One looks for the amount of provider increase by locality, so the number of localities that show an increase in provider count, and that's in orange. And then the blue represents the number of localities that show an increase in service type. And so we did see a 1.5% increase in service type over the last 6 months. And that particular change helped us meet this measure. So there has to be an increase in one or the other charts in order for us to consider that to be an increase in services available, whether it's service type or it's provider count, but it's got to be one or the other. All right, so measures 4 and 5 go together. We're going to start with measure 4. So measure 4 is 95% of provider agency staff meet provider orientation training requirements. So if you are a provider in Virginia, you should be familiar with the quality service review process. It has two components. It has a provider quality review and a person-centered review. Measure 4 is based on the provider quality review. And there are actually three elements in the PQR that trigger an alert to DBHDS that are related to providers not having documentation in place related to staff meeting these requirements. And so when DBHDS receives an alert for that, we do follow up with providers and provide technical assistance around the competency process and the documentation that's required for that. There were 302 provider quality reviews in round 5, and of those completed, 235 providers had the evidence that was necessary to meet this measure, which gave us a success percentage of 77.81%. In terms of how we validate this data, we do take a report from HSAG, and we compare that against a DBHDS tracker, and we do that to verify that what they identified and sent to us, we received and accounted for. And we do this to ensure accurate data across the board. And where we find differences, we reconcile those through the data verification process. All right, and this is measure 5, which is related. This one is 95% of provider agency DSPs meet competency training requirements. This one is assessed through the person-centered review, and it's more related to the direct observation of DSPs and whether or not those DSPs are demonstrating competency in supporting people with developmental disabilities. So 492 of the 577 person-centered reviews that were completed did not have an alert for competency issues. So that gave us a success percentage of 85.27%. This is verified through the same method as measure 4. Instead of 3 elements, there are actually 12 elements in the PCR that are used in determining success with this particular measure. The only other thing I would say about this is that measure 4 and measure 5 are companion measures in that both of them have to be above 95% for us to meet the expectations laid out in the settlement agreement with Virginia. All right, measure 6, at least 75% of people with a job in the community chose or had some input into choosing that job. We pull this data directly from the National Core Indicators report. You'll notice here that Virginia is at 92% with a weighted national average of 93%, so we're very close. We since we do obtain this information from NCI, sometimes there's a delay in terms of our the availability of Virginia's data. So right now we're waiting on more recent data in terms of the state report. And once we receive that, we'll be updating this particular measure with that data when we have it. There we go. All right. So this is measures 7 through 10. They sort of are grouped together because they are similar and they are assessed the same way through the ISP. So measure 7 relates to 95% of people receiving services in residential settings, participating in the development of their own service plan. Measure 8 is 86% of people choosing or helping decide their daily schedule. Measure 9 is 75% of people who do not live in the family home chose or had some input in choosing where they live. And measure 10 is 50% of the people who do not live in the family home chose or had input into choosing their housemates. And so you'll notice the two colors here. You see yellow and green, and yellow represents the entire waiver population. So that's everyone with waiver across quarter 2 and quarter 3, those folks who had an ISP during those 2 quarters. We do tease out the green columns as residential only, because you'll notice in the wording of these measures, they are really seeking folks in residential settings or people who don't live in the family home. So we needed to add those green columns to really get at whether or not we're achieving the measures as written. All right, measure 11, DBHDS service authorization data continues to demonstrate an increase of 3.5% annually of the DD waiver population being served in most integrated settings defined by the Integrated Employment and Day Services Report. So this is not really focused on residential. It's more focused on individual supported employment, group supported employment, workplace assistance, community engagement, community coaching versus group day support. So you'll notice that group day support is in a darker gray color, and that's because that is representing the lesser integrated day service compared to the others. The tables there show you the baseline count from 2016, and then it shows you subsequent annual assessments of participation in these services. You'll notice that the annual timeframe that we're looking at for this particular report runs from March 31st of 2022 to March 31st of 2023. And what we see when we look at that time frame is that there is a 2% decrease. So we are actually below the expected 3.5% increase that we hope to see. The line graph that you see on the right-hand side kind of tells the story in terms of the pandemic and what happened to day services in March of 2020. You'll notice that we were doing very well in 2018, 2019, but as soon as we get into 2020, numbers fell off. And we are here in the end of this chart on March 23, starting to see an uptick after a lengthy decline that spans the pandemic. All right. So this is a comparison of living situations. We're looking at baseline of 2016 compared to March 31st of 2023. Some of the things I would point out here is the increase. It's a small, but still an increase in group homes of less than 4 beds. You see about a 2%, little over 2% increase there. But you see about a 50% decrease in folks living in group homes of 5 beds or more. So that's a pretty significant decrease. There really was no change, no notable change in sponsored, but the other options, with the exception of other, did see increases or slight increases in counts over that same time frame. So the report itself also contains demographic data, and this is just sort of FYI, information about the system that you might find helpful. It is pulled from different sources. So this first table at the very top here tells you the number of individuals with each of the types of waiver and then breaks them out across each region and gives you the totals. So if you're curious about how many people are in each waiver in each region, this chart will help you get there. The two tables at the bottom are pulled from either DBHDS tracking forms that are used by various offices within the department, or the number of licensed DD providers is pulled from Connect. We did go ahead and apply some arrows to these after the fact so that you can see whether there's an increase or a decrease from the last report. So looking at the second chart, you'll see that there, and I think it was a very slight increase of maybe, I want to say 2, but don't quote me, I'll have to look it up. But a very small increase in children residing in ICFs, a small increase in children residing in nursing facilities, and a increase also in people living in independent housing, which is good. We did see the training center census fall to 66 in Region 5. We also saw a loss of providers, I think around 80, 89 providers across the system. You'll see 1505 is the current count as of this report. We saw an increase in supported employment providers, no change in ICF beds for children, a decrease in ICF beds for adults, and independent housing options remain consistent across the last report and the current report. All right, so this is a side-by-side comparison of the 10/31/22 Connect data with the April 30th, 23 Connect data, so that it was actually 83 in terms of an overall decrease in the number of providers. We went from 1588 in October down to 1505 in April, which is an 83% decrease. There were decreases across all of the services except case management, of course, was consistent. We did see an increase in group home, DD group home services going from 588 to 591. There were no changes in group home reach, and there were no changes in ICF-IID for children and adolescents. All of the other ones experienced a decrease in the provider count overall. All right, so this one is showing that all of the different waiver services and the utilization. Well, I won't say utilization, I'll say authorization, because we actually use authorization data to pull our numbers. So this shows you the total number of people authorized for each service across all regions. It also shows you the regional breakdown in terms of the number of people in each region that are authorized. It also teases out the number of authorizations in each service for people at level 6 and at level 7 in terms of support needs. So overall, there was a 217 count increase in the total number of individuals authorized. For the regional numbers, Region 1 saw 41 more people, Region 2 saw 90 more people, Region 3 saw 18 more people, Region 4, 33, and Region 5, 35. There actually was a decrease in level 6 down to 26 and an increase in level 7 up to 27. So it can kind of give you a sense of the changes that are happening across service authorizations. We also track with Nathan Hobble behavioral data, and this shows changes in the providers or provider groups offering therapeutic behavior consultation. And then it has a regional chart to the right. So from FY22 to FY23, we saw an increase of 6 providers of therapeutic behavioral consultation. You'll notice that regionally, the highest number is in Region 1 at 38, and the lowest number is in Region 3 at 24. So on the DBHDS website, Nathan did work with the various behavioral consultants around the state in setting up a search engine. So if you are a support coordinator on this call and you are looking for therapeutic behavioral consultation for someone you support, you can go to the DBHDS website at the link shown at the bottom of the screen and go in and click on search engine and look for providers in your area. So it's a really helpful way to find behavioral service providers. Children and Youth Residential Services was added at one point at request. We had a request to add this, and I'll just reiterate what Barry said at the top of the call is that, this information is for you as providers, and you can take data and cut it and slice it a lot of different ways. But what we want is to provide you with something that will be helpful for you and will inform your business decisions around service provision. So just let us know if this or other information would be helpful. So when you look at these two tables, they represent different types of residential services for children and youth. I think what's notable here is that the group home residential supports for 5 or more, there are 0 approved authorizations across the system for 5 beds or more for children or youth. You'll notice that there are also no providers in the second chart. So the first chart is individuals and the second chart is providers. So there are 0 across the board there. You'll notice that the numbers you want to pay attention to here are the distinct totals. So there are 29 authorizations for children and youth in the system for these services, and there are 10 providers of these services. The numbers don't add up across the columns because folks move. So someone might move during the report window, which will have them be counted twice into regions, but we do the distinct total column so that we can count the unique individuals and unique providers. Right, so these are our current children's providers and where they're located. This is in the report as well. So if you are looking for someone who provides children's services and where they're located, this chart will help you get there. All right, next we're going to talk about report automation. So a lot of the visualizations you're going to see today were produced in Power BI. And we've been working with our data warehouse team to create an online dashboard that will be available to the community to use to look at some of these numbers, to go in, to download the data, and to work in Excel, and to kind of explore how the data might be most useful for you in terms of your development. So one of the things I would mention is it's a much friendlier way to use the data. This would replace, I think, we're looking at whether or not this will replace the baseline measurement tool. I don't know how many of you use that now. If you do use it and you think it's helpful, please drop a note in the chat. But once it's in Power BI, you may be able to pull the same information. But as this development wraps up, we'll confirm that and let you know for the next report. But visualizations that are in Power BI refresh with updated data at regular intervals. That means you could go in there monthly and be able to pull more current information rather than waiting 6 months or 9 months to get more recent information. The way you navigate it once you get in there, if you're familiar with Power BI, is there's a series of tabs on the left-hand side of the screen, and you can go from visualization to visualization by using those tabs. And you may choose to download data for any individual visualization and then be able to manipulate or work with that data yourself. So much more user-friendly. Also, in terms of features in Power BI, it provides the ability to filter the results online, and not only Excel, but if you want to maybe present something to your board and you want to do a PDF of a visualization, or you want to do a PowerPoint for them, you can also export this data to those additional formats. We'll make it easier for you to have conversations within your organization. And then finally, it gives you the ability to see more data in one location and to see comparisons across longer timeframes. So a lot of times in our reports historically, we've looked at 3 timeframes: baseline, 6 months ago, and today. And so now that we're going to be loading this into Power BI, it's going to create the opportunity to look across a full year or 2 years or 3 years using Power BI to do so. So we're excited about the opportunity. All right, I'm watching the time closely to make sure we get through this. So the next section is statewide and regional service data. It's based on authorizations, as I mentioned earlier. So this is going to be looking at provider counts and individual counts of the different services that were mentioned at the top of the call. So This is distinct provider count and distinct individual count for 4 different services: supported living, sponsored residential, shared living, and in-home supports. I think what's notable here in terms of provider count is that we saw increases for both in-home supports and sponsored residential. We actually saw 7 more providers of in-home and 16 more providers of sponsored over the past report period. We did see, in terms of individual authorizations, increases in those services. Well, for sponsored, we saw 92, and in-home we saw 79. And then for supported living, we saw an increase of 23 authorizations, which was also good to see. No change in shared living, which indicates that that continues to be a need across all regions. For community engagement and community coaching, you'll notice we added 2 providers of community coaching and 6 providers of community engagement. We added 194 individuals to community engagement and 11 to community coaching. Apologize for the dog if you can hear my dog. This service is crisis support services, and I think that this is definitely a gap in all regions. You'll notice that there has been a downward trend in the availability of crisis support services, actually arriving at 0 as of April 23. So we have no providers and no individuals receiving the service. So if you are interested in offering crisis support services, please reach out to your provider team CRC and get more information. We'd be happy to help you provide this option. All right. For the next services, which relate to nursing, so we have here represented in yellow on the left about private duty nursing, and in green skilled nursing. We saw an increase of 2 providers of private duty, and we lost 4 providers of skilled nursing, which is not surprising given the nature of skilled care. I mean, it could come and go depending on the doctor's orders. So we did see 4 fewer providers of skilled nursing. We saw, and those 4 providers may still be operating, they just don't hold authorizations at this time. So just recognize this is authorized data. There were 4 more individuals receiving private duty nursing, and we have 15 fewer individuals receiving skilled nursing. All right. So next is community guide, electronic home-based supports, employment and community transportation, and peer mentoring. I think what's notable on the left is that we added 1 provider of community guide. We went from 7 to 8. There has been on the left, on individual service authorizations, there has been substantial interest in electronic home-based supports. So you see that light blue line just rising above all the others. So we've gone from 1 person in May of 2018 to 111 as of April of 2023, actually adding 18 in the past 6 months. So a lot of interest in EHBS. We saw 13 fewer authorizations for community guide. We saw 8, and this is good to see, an increase of 8 authorizations for employment and community transportation. And we saw 1 individual authorized for peer mentoring. Oops. There we go. All right, so next is group home residential, whether that's less than 5 beds or 5 beds or more. We see an upward trend here in the 4-bed or fewer option, with 27 new providers of that smaller group home size occurring in the last 6 months. That's going from 438 to 465. We actually saw a decrease of 1 provider offering less integrated group home, which is 5 beds or more. In terms of authorizations for 4 beds or fewer, we saw 195 people come on authorizations during the last 6 months, and we saw 97 people end authorizations for 5 beds or more. All right, these next charts are really just going to focus on gaps. This is the regional data. I'm going to kind of just hit the highlights to keep us on track. So you'll notice here benefits planning in the upper left-hand quadrant. I think what's notable here is that we started with 0. in May of 18 across all regions. And at least, by April of 2023, we've got representation in all regions. Region 3 is a little bit low with only one provider, but the other regions are at 3 or 4, as in Region 2. So we have seen growth in that service. Just below that, community engagement, there is a definite opportunity for community engagement in Region 2. You'll notice that the counts of community engagement in Region 2 are about half of that of the rest of the regions. And we know that population density in Region 2 is significant. So there could be opportunities there. If you're a provider, you might want to reach out to a CSB and just ask if that's something that they think could be helpful in their community. Up in the left-hand the right-hand upper quadrant, community coaching providers, the lowest numbers are seen in regions 3 and 4 with 6 and 7 respectively. Community coaching could be more time limited because the intention behind that service is to support folks to move into community engagement. But again, there are fewer providers in regions 3 and 4. On the lower right-hand side, community guide providers. You'll notice that Region 4 has 0 as of April of 2023. So if you are interested in community guide, especially in Region 4 or Region 5 or Region 3 for that matter, reach out to your CRC and see if they can help you explore that as an option. Okay, next, make sure I got the right slide. So on the upper left-hand side, electronic home-based support services, you'll notice that we started with 0 in May of 18, and we have seen one provider in Virginia that has steadily grown and now covers all regions. However, that's only one provider. And I think they would stand beside me and encourage other providers to step up and offer this service as well. But if you're interested in offering electronic home-based services, please reach out to us. We'd be happy to help you with that. Just below that, independent living supports. You'll notice that in Region 4, there is a low number of providers of this option. This is for folks who receive building independence waiver. You'll notice in Region 4, there are only 3 providers of this service. So that's the lowest count. So there might be an opportunity there for development. In the upper right-hand side, employment and community transportation providers, there are 0 providers in regions 3, 4, and 5. So across the board, this is a needed service. We hear it in phone calls with families and with people who have services, with support coordinators, et cetera. So if you're a provider and you want to explore offering this, we would be happy to talk with you about how to make it be most efficient and effective within your services. Also, in-home support services, you'll notice Region 3 and Region 4 have lower numbers, with Region 4 being the lowest at 21. So there might be an opportunity there, just depending on the population. When you look at the baseline measurement tool or you look at the demographics, you can get an idea about how many people live in which locality, and that can help you kind of hone in on what sub-region you might want to offer services in. Okay, so peer mentoring is needed in all regions. We only have one provider in Region 4. Just below that, supported living, their lowest count, about half the number of regions 4 and 5 or Region 3. So you'll notice that Region 3 definitely could use providers, but this is probably a needed service across the system, providing more apartment type living and more independence for folks. It can be provided either in a provider operated setting or in an individual's own home, depending on which license you have, whether you have a supportive residential license or a supportive in-home license, but you can offer this service in both of those settings. Also, shared living, there on the upper right-hand side, you'll notice that there are only 2 providers, one in Region 3 and one in Region 4 in this. There's 0 providers in 1, 2, and 5. So we have training materials available for shared living. If you want to explore that and create that option for people who you support, then please let us know. Crisis support services, also, this is the story we saw earlier, going down to 0 authorizations and 0 providers as of April 23. So that's needed in all regions. Okay, and then finally, we're going to talk about private duty and skilled nursing as well as sponsored residential. So private duty, you'll notice that probably Region 3 has the greatest opportunity for offering nursing services because they only have 6 providers of private duty nursing. In terms of skilled nursing, you'll notice the lowest number is in Region 4 with only 1 provider as of April 2023. Sponsored residential has shown a steady increase over time. You'll see the upward trend there in the bar chart. You'll notice that Region 2 could be an opportunity for offering sponsored residential because there are only 13 providers in Region 2 for that service. And then finally, group home, so less than 5, you'll notice that the numbers are much higher in terms of providers of 4 beds or fewer versus 5 beds or more. You'll notice that, let's see here. So Region 5 has 162 as of April 2023. And if you look at their less integrated group home count, we're down in the around 30. 31 as of April 2023. So there's a much higher number of providers offering 4 beds or fewer than 5 beds or more. All right, so next we're going to talk about, finally, this is the last section, we're going to talk about identified service gaps. So we did pull this information from the waiver management system and the new RST module that went live on January 1st of this year. For now, all we have is a table in the report. We will work to create visualizations off this. But what I wanted to do today is just kind of explain how to interpret this and how to use it. So this does represent RST barriers. Basically, we streamlined barrier collection in the transition to WAMs. We used to have, I want to say, in the neighborhood of 16 to 19 barriers that could be coded in a RST referral, and we've cut that number more than in half in terms of the labels for barriers. So the label for the barrier is there in the first column. So where you see barrier to service, you see individual slash SDM choice. So it was the individual or family's choice not to pursue more integrated options. And that's what we considered the reason the RST could not be effective in supporting or in making sure people are making an informed decision about more integrated services. You'll see the service option that was tied to that particular referral. In bold, it's a total count. In where it's not bolded, that's the quarterly count. So for group home residential 4 or fewer, you'll see a bold total, and then for quarter 3, you'll see a total that's not in bold, and quarter 4 not in bold. Then we have the quarter represented in the next column, SFY quarter RST requested date. You'll see the regional breakdown in terms of the number of occurrences or the number of referrals where that barrier was identified and where it was identified, along with the total on the far right-hand side. So if we were going to take one example from this in terms of how to use it, let's look at shared living there in the center of the screen. So you'll notice that shared living had a total number of barriers during the report period, which was quarter 3 and quarter 4, of 2 occurrences that occurred in Region 2. And you'll notice that one of those occurrences occurred in quarter 3, and one of those occurrences was in quarter 4 for the total of 2. So it tells you that somebody in Region 2 is looking for shared living. So if you were a provider looking at this, it kind of helps you understand, interest. So somebody was looking for shared living and couldn't access it or had trouble accessing it. And so it's really about, what is the barrier that was identified. Now, what the person ultimately chose may or may not be shared living, but it tells you kind of what that service was related to, what the barrier was related to. Right. And this chart just goes through the different themes. So you'll see here a lack of behavioral expertise to interpret it and read it the same way. We also have lack of medical expertise. So if you want to know which regions are finding barriers around different services for medical expertise, you could look at this particular table. You'll notice lack of provider referral other than integrated residential is a barrier. So it shows the frequencies that has occurred. No integrated residential provider operating in desired area. Now, this data, you'll notice it says pre-system update. So we did, because the module was new, have to pull some data in manually while we made edits to the system to improve the system to get it to where we need it to be. So we had to do some manual counts and combine that with some waiver counts. One of the things I'll tell you about this particular barrier is this is one that has to be confirmed by the RST. So if a support coordinator does a referral and says, oh, there's no sponsored residential in Region 3, and so they say that service is not available, it's not operating in Region 3, they just may not be aware that it's there. And so it's really the RST who confirms whether or not that's true. And so we now have a separate section in the RST process where we can see what the RST confirmed as to whether or not that service really was or wasn't operating in that region. There is a specific DOJ measure tied to this particular barrier, so we track it very closely. All right, we also have provider available, but access delayed, and then finally provider setting and match. So I think we managed to get through everything just under time. We will go ahead. I don't know if we probably won't entertain questions right now, just given the time, but we will let this stay open for a couple of minutes. And if you have thoughts, questions, suggestions, please drop them into chat, and we'll send out Q&As afterwards with the presentation. So thank you very much for joining us today, and hope you have a good weekend. Thank you.